we have here is 3 components. Where Dr. Monkfus setting is what we call our surgeon console. It's where they actually do the operation. This is what we call our patient cart, or some people refer to this as the robot. This is the operative component of the system, which we kind of call our arms and hands of the system. Where Dr. Monkfus setting, we call it the brains of the system. This is what we call the eyes of the system right here. This is our vision tower, and our instrumentation works to where the doctor's in 100% control.
Once I put my head in, it senses, okay, the surgeon is looking at the camera and can control the instruments. So, there you go. And you can look at the monitor. This kind of demonstrates what the thing can do. Move it over and put it on the one there. Grab the penny, move it around. So it's kind of a very neat instrument to allow us to do microscopic procedures. There is a little bit of perception with the hand, but not much. You know, I'm not handling the instrument.
You don't feel it, yeah.
I don't feel it as much, so.
Yeah, this is cool.
Do you do anything with your feet? I noticed the pedals.
So the feet, this one is to focus the camera. This one is to allow my hand to move the camera. It does take longer than open surgery, there's no question about that. As with everything else, the more you do it, the faster it becomes. But the benefit is obviously less pain for the patients, shorter stay in the hospital, faster recovery. It's really quite amazing, the technology that goes in that and all the safety mechanisms. You have to have surgical training because, you know, being able to understand the anatomy, what you have to do, moving the needle driver through tissue, dissecting blood vessels, all that is done through your years of training as a surgeon. Then you go off to a lab where we work on animals and cadavers. And once you get it through that, then the FDA gives you a certificate that you've trained on the robot. And once you train on that, you're allowed to start using it on patients, but not by yourself. Usually you have to have a senior surgeon who has more experience on this already. The advantage is really a tool to allow us to operate through small holes. So when you're trying, let's say, to resect cancer of the lung or cancer of the uterus and you're in the pelvis, and you're trying to do it through a tiny incision, you lose a couple of things. One is your vision is gone, so you can't really see through a tiny hole. You have to put a camera in. And the camera here is a 3-dimensional camera, so I get depth perception very well, versus just like a TV screen.
I mean, when you're looking in there, you see 3D. You don't
Right.
see what we see. You
Yeah,
see 3D.
so I'm seeing 3-dimensional things. I can tell depth of my instrument and such. So then the other advantage to the system is, again, through a small incision, we only have so much room to place instruments. And if you think of if you have an instrument that's really long at the bottom of something and it's going through a hole, you have a small fulcrum. Okay, you can only move it in so many places. What this does is this shaft that's going through here is independent because all the movements are down there, so it allows me to move in a lot more directions, up, down, sideways, without having to make this incision bigger, which is the advantage of robotics versus laparoscopic.
What can this robot do? The robot can differentiate between the elements that can be recycled, which are and paper, cardboard, plastic, in the order that the robot can contribute to the separation and the freezing of the recycling in bags, and zones and streets, characteristic that make this road work. It has wheel rods in the shoulders for moving up and down, and a key or two sets for grab the materials. In the head, it has a camera and sensor for identifying the key for the movement. It has shield that help the robot move by aim down. Finally, in the torso, it has a laser light for illumination dark places and for night stuff.